Hey, welcome back, everybody. We have Mysti Motz with the Madison County Health Department. Welcome, Mysti. She's coming in remotely today on the phone. How are you?
I am great. How are you, Randy?
Fantastic. And Colleen is here. She can hear you, but you can't hear Colleen because of some technological glitches we had, but we'll work it out because the important thing is we can hear you, Mysti.
That's right. Well, thanks, Randy.
So, Mysti, what exactly is on your list to talk to us this week on this great July 4th Saturday?
So we're going to talk a little bit about the difference between quarantine and isolation, the importance of wearing a mask, and a little bit about the contact tracing and what that is.
Okay. All right. We'll start with, on your list, with item 1, ma'am.
So quarantine is more for people that have had a close contact. So that's going to be within that 6 feet for more than 10 minutes or so of someone who is a positive COVID-19 case. And that is important to try and help mitigate any spread. Okay. So if you've had that close contact, we ask that you stay home for 14 days, kind of watch yourself for signs and symptoms. Isolation is for those patients that have been diagnosed with COVID-19, especially when they're symptomatic. We want them to stay home. It's usually full 10 days up to 14 days, depending on their symptoms and how they recover.
Sure.
And that's to help prevent the spread as well. But we want them to kind of isolate in the house, try to stay in one room, using only one bathroom. So that's kind of the difference between quarantine. Quarantine is you want to stay home away from others in case you did pick it up.
Right, exactly.
Isolation, we know you have it, so we want you to stay home and get better, but staying home and away from others is the key.
Got you. Okay. And that's the difference between those two, correct?
Yes, the quarantine is mainly for those who have had any kind of close contact. Isolation is those that are sick. We want them to definitely be kind of one space only, trying not to have it all around the house, trying to protect others in the home.
Okay, got you. Okay. Now, let's talk about mask wearing. Where should we do that, and at what times, etc.?
Okay, so mask wearing is there's a lot that goes into that, but the keys are wearing it when you're around others, especially people that are not in your typical circle of people you are around.
Okay.
So any kind of public places, anywhere that there's more than a few people that you are not usually around.
Right.
So grocery stores, any type of small gatherings you go to, the key would be to wear it. And the important part is that it covers your nose and your mouth. Yes. That way it covers all those spaces that you could breathe anything in. And it also protects those around you, because if you're wearing it and you have a symptom, you're not spreading that to them. So it kind of protects both of you by wearing that. There's a big myth out about a cloth mask not being as protective. The goal is to lessen the spread.
Right.
It might contain all of it, but if you cough into a mask, you're not coughing as far as you would if you were without a mask.
Right, right. So it keeps those particles down, definitely.
Yes, and it protects you from breathing in particles from someone else that could be coughing as well.
Exactly. And it's really not that inconvenient. I mean, I've done it. I try to go in like at Lowe's, and my rule is if I know I'm going to be in close contact with people I have to talk to, I wear my mask.
Yes. Especially people you're going to be having a conversation with. If you know you're going to be around more than passing by.
Yes.
That's a really big key. A lot of people don't realize that it's important that it stays above your nose the entire time, because you can still breathe in that way. So we want to protect that whole area.
Right. And Mysti, let me ask you, I like to power walk. I like to go on my walks around Gibson Bay. So speaking of which, wearing a mask around, if you're passing by people that are walking too, and your contact is like really quick, like, you know, you pass by and you're both moving and everybody's moving and everybody's pretty much far apart. What's your advice on that?
The goal would be to still have a mask if it's people that you aren't very close to, you don't know where they are, where they go. So anyone outside of your home circle that you are around at all times anyway. Okay. And even in the house, sometimes if someone in the house becomes symptomatic, you would want to try and separate as much as possible, wear a mask while you're around them in that close proximity.
Gotcha. Okay.
Even that quick walking by in the parks, things like that. If you have your own backyard, that's your own little oasis, that is completely acceptable. Go in your own backyard. You don't need it there.
Sure.
But when we're in public, the key would be to wear it there, because it's hard to contain who all is around each other.
Right. Exactly. Okay. Colleen, I think she has a question. She looks like she's ready to pose a question. Colleen, do you have a question for Mysti?
No, I think that all of the advice that Misty is giving is excellent. And I would also say, that I'm a huge mask wearer, and I'm also a severe asthmatic. And I have no problem breathing through the disposable surgical mask. I've talked about that before. Okay. So I think that Misty and Randy, you also brought up a good point. If you are in a public space like that, and even if you are exercising, hop out of the way. Sometimes when you're in outdoor spaces, you're kind of in a different mode of thought.
Mindset, right. With the outside spaces, right.
Exactly, with the outside spaces, and leave some room. Sure. I see a lot of folks doing that, and I think that's just common courtesy these days.
Sure. Misty, now let's move on to contact tracing. How exactly does that work, and why is it important?
The contact tracing is, so the basic process, let's just start from the beginning, make it a little easier to understand if I walk you all the way through it.
Sure.
When we get a positive case, we kind of ask them some questions. We make sure that they're okay, what they need, if there is any resources we can help provide for them. And then we ask them who their close contacts might have been. And that is to make sure that those people are aware of that close contact. That way, if they have signs or symptoms, they can seek care if they need to. They would be aware that they need to protect others in their home.
Right.
That they would be very careful about going anywhere else. That's where the quarantine comes in place. Okay. So when we get a list of those people that they were in close contact with, we just call and make sure that they're aware. We don't share any of the information about the case because that is HIPAA protected.
Sure.
We would call and let them know you've been in close contact, you've been identified, and then give them education and information and try to help them with anything they may need and discuss signs and symptoms to help try to stop the spread as much as possible.
Okay.
We can also give them information about how to talk to their employer about that situation. We can work with them on staying home from work and from other places, like going to doctor's visits, things like that.
Okay. Excellent. That's fantastic. Misty, since it is July the 4th.
Yes.
So do you have some advice for people for July 4th while also celebrating?
So social distancing is going to be the key there. Even if it's multiple people in the area, you can have a great time and watch those amazing fireworks, but that 6 feet is going to be your key.
Right.
Even in open spaces, if we keep that separation going, you're going to have less contacts. Because the key would be, if I call, we don't have 25 people to lift, right?
Right, right.
So, and that is going to make it more fun, because then we're not worried about anybody being sick. We can have a great time, enjoy the outdoors, and enjoy those amazing fireworks. But wearing a mask, if you're going to be in the public places watching those fireworks, is key as well.
Absolutely. And I think the Richmond fireworks, I know, and I don't know about Berea, but I'm assuming the same thing, is that I think they want everybody to stay in their vehicle.
Yes, there's been signs around Berea that I've seen that have asked us to continue to practice social distancing, keep outside.
Exactly. All right. Misty, thank you for being with us today on this July 4th. We appreciate having you, so we can't wait to actually see you in person.
I know. I thank you for calling and having me here, and I can't wait to see you again.
Randy, for more information, where do folks need to go?
Yeah, I'm sorry. Colleen wants to know, for more information, where do people go to get all this information, the best place?
So there are two websites that are awesome. The kycovid19.ky.gov
Gotcha.
has a lot of the information for employers, for you as an individual, and for any type of businesses. Mm-hmm. And then the cdc.gov has a lot of the information about when to quarantine, how to quarantine, wearing a mask, even how to make some homemade ones.
Good. Absolutely. Well, thank you, Misty, for coming on today.
Thank you.
All right. And have a great 4th, Misty. We can't wait to see you soon.
You too.
All right, folks, we'll be right back after this.
Things are a bit different for now, but the Madison County Health Department wants you to know our clinics are still here to serve you in any way we can during the COVID-19 pandemic. Here are the current clinic days and hours of operation. Some visits can be completed off-site over the phone, so your first step is to call ahead. If you do need to come to the clinic in person, you'll notice we have a new doorbell for your use. One of our friendly staff will acknowledge your presence, and we will send someone out to serve you in your vehicle at curbside. If it is determined you need to come into the clinic for some services, We'll have hand sanitizer and a mask waiting for you in the foyer. You must put on a mask and use the hand sanitizer before entering the lobby area. Thank you for helping us ensure your safety and ours while we continue our mission to protect, promote, and improve the health of our community.